Not major.
Good. Nobody else?
Over the counter.
Huh?
Over the counter drugs. Over the
No,
counter.
no, what is primary health care?
Vaccination, that.
Correct, you're right. Don't, you're right.
Vaccination.
What is primary health care? That is his idea of primary health care. What is your idea of primary health care? Hey, come on, quick, what's the time?
Assurance, insurance.
3 o'clock.
More than a first aid.
More than the first aid? He is coming to something. Okay. Primary health care takes into account a healthy person who is sick but doesn't require great intervention. Okay, he's a first target, like our old GPs. Okay. He will know your mother, how she gave birth to you, he will know you, he will know. I don't know if you all have gone through that. In our days, we used to have one fellow. He will know everything. And he'll look at you, he'll ask you to pull out your tongue, he will press you on the stomach. Okay. And he'll come out with amazing stuff, which today you need a CT, MRI and all to discover. No, seriously, the old GPs, they knew everything. Because they knew that most of the time it is not something great. Today the healthcare industry, because it's private and because it's there for money, is looking at all tertiary care. This is where all this cardiac surgery, renal transplant, those sort of things, tertiary care. So you're hospitalized, you're put in the sick. And if you look at the spend of healthcare, you will find that nearly 40% of the spend in healthcare comes from 5% of the population, which is in tertiary care. Okay, so it's lopsided. And private people will go to places where they make money. So instead of, when they have, this is a marketing guy's dream. You segmented the population and you've got 5% of the population giving you 40% of your money. The real marketing guy's dream. Okay, so they have stuck onto that. That is managed care as far as they are concerned. Right now, the social care takes care of this thing, but it's also a link between the private care and self-care. Self-care is when we take OTC drugs, headache, take one. My wife for many years, if she had fever, if she had headache, if she had, she stubbed her toe, anything, she would take paracetamol. Okay, it's a cure-all for everything. When I asked her how it helps, she said, I don't know. Probably placebo. She takes 2 paracetamol and she's okay. So, self-care is dangerous also. But what is going to happen is, this is going to expand. This self-care. Why? Come.
No, technology.
What technology?
Like he said, that bands which will monitor your health.
Absolutely. You are absolutely correct. You have an iPhone? You have? Well, the iPhone, the new one, I wasn't, this is not the new one, the new iOS, they have everything. They have, I was shocked. They have sleep. This phone now I realize after going through that as I move, it measures my movement and tells me how many steps I've taken in a day. The phone, without me knowing. Okay, and like he says, it's got all sorts of things.
Sensors.
So that is going to make a patient what?
Awareness is there.
Informed patient.
This test which are
Okay.
conducted.
Right now, patients are a pain because they come to the doctor and say, see, my symptoms are this, and I have this disease. So please treat me, because the guy has gone through the net. Okay,
Yeah.
seen a whole bunch of symptoms,
Correct. Yeah. Now I know.
matched the symptoms to this thing, and he has come. And this is not I. When I was in Jaslo, okay, I used to, when driving the car, I used to suddenly get blackout for a second. Now, me being me, special person, it can't be anything other than brain tumor. So I went to, there was one Dr. Dastur. He is one of the icons of neurosurgery in Bombay. He was also in Jaslo. To get his appointment takes 3 months. But because I was there, I managed to go and I went and saw him. He said, okay, you lie down. And then he pulled me up. He went blank. Beta, tikra. So go away. Don't waste my time. This is just your problem. It will go away on its own. So it's gone away. But the problem is we read so much
Yeah, internet today.
and we assume. In those days there was no internet.
It's
We used to read these journals and we see all this. We have no clue what they are writing.
Yeah. It's a
Okay, and we assume that will change. This is an informed decision. But tell me, where is the roadblock? Yeah, let's have it from you. This is a serious question. Where is the roadblock to an informed patient? Why is this primary care not taking off? See, private individuals want to get into primary care. There's big money. You know, if you shake hands with the government, you are in big business. A primary health center will have about 1 acre land, one building, one car shed with an ambulance. It will have amazing stuff, but nothing gets done. Why? What is blocking us? Have you thought?
I mean, I do not know the reason, but if you look at the recent startups, there are a couple of them, they are into primary healthcare.
All of them. I have gone and met them also just to see what it is. Okay.
Maybe the very reason. I mean,
No, they are actually into primary health care, not in rural area. They are concentrating on urban populations, which require this thing. They are informed already, and they can get this thing done. So that the guy in Indranagar, Shantanu, what he does is, he is planning to get an app where you pull on that app and you do a conversation with the doctor, and if the doctor calls you to the clinic, you have to pay. If the doctor doesn't, you don't have to pay. But those are for informed patients. None of them are interested in this real primary healthcare. Primary healthcare includes preventive medicine, which nobody is talking about. How to stop people from becoming fat, how to stop people from smoking. Nobody is talking about that. So where do you think is the block?
so I feel like the reason is that the segmentation itself, it's a large chunk and less profitable. Whereas tertiary care, you do one renal transplant, it will fetch you 30 lakhs.
No, madam. No. Numbers will give you. The problem, I'll tell you, is what you were saying. Diagnostics. You can do ECG and send it through the
Precise,
net
actually,
and
the
get it read.
correct.
You can do X-ray and send it to the net and get it. But what do you do about blood tests? You cannot do a blood test unless you transport that blood from there to the point. Glucose is not all. Creatinine, basic this thing. Everything is not there. That is a stumbling block. Now, that can happen with again informed patients. They know when to take a prick.
Yeah.
What do you do for
Non-
non-informed patients? The equipment is expensive. Everyone doesn't have an iPhone. I had a well-wisher who got me an iPhone, otherwise I would have not got. So there are, but that is where the problem, and that is where that thing I was telling you, they buy the company and close it down.
Yeah.
Because the big diagnostics are in the hands of 4 or 5 people: Siemens, Roche, J&J,
G.
not GE so much, and these guys will not allow themselves. Roche, take Roche. Roche has a handheld iStat machine which is beautiful, but they don't promote it. Roche in India has their own office, have their own staff and all that. iStat is given to some idiot in Hyderabad who is not interested in it. So officially if the government asks, they say we are giving it to him. But they make sure that it is not pushed because it will cannibalize their business. So that is where the thing is. See, this is what you are saying, blood pressure machines. Tricon. These guys have $10 million price to make something like, have you seen the Star Trek that Scott has that thing? He puts it to you and he gets a... This lady, she has developed a method of doing HIV, HCV, HT. You just put the blood in a test tube and shake it and look at it and you can give the answer, but it's closed off. Somebody has bought it and wiped it out. That's it. Okay?
Question answers.
Questions and answers are all done, no? We finished it. They are already tired.
The server is down.
Huh?
I didn't write it.
You didn't read it?
Yeah, message I didn't
No,
read.
that is the message actually. Closing note.
Last
Last page. Disk space is low. It's a closing note.
Innovative way of telling I'm done. Someone does not enough space to continue.
This I saw it somewhere.
Unique way of telling you I'm done.
I don't like these thank yous and
boring.
clap and all that will be there, no?
So
Okay.
this medical equipment, low cost medical equipment has lots of opportunity. That was also.
And somebody will come into it. There is a company called Alair. Okay, it is your Canadian based. Huh? But that Indian guy, their operation is crazy. These fellows, what they have done is, they have gone around buying companies which manufacture. See, the next thing is from wet chemistry to dry chemistry. What you are saying, that the thing is dry chemistry.
Dry chemistry.
You don't need reagents, you don't need a water bath or anything. It's dry chemistry. Dry chemistry is expensive today, but it will come down with time. Okay, so that dry chemistry, these fellows have got a monopoly. But there, see, the problem with India is we give CEOs who are there to make some money. Okay, so what happens is these guys come and con these foreigners. You talk big and all that, the foreigner gets the thing, you will give some fantastic figure, they all believe it, and then they set up operations here, and then suddenly they find that the results are not coming. Okay, then they feel that the Indians are the ones who are not, they get a negative listing on their Indians. That is the whole problem with it. Very good company. But it's not been marketed in India for I mean, it's marketed, but at high side.
There is one more drawback, the healthcare side. Developed countries, they are squeezing, like Obamacare, that was subsidized recently. But earlier, it was very expensive to buy healthcare sitting in the US. Or in UK, it's automatic. But I had to wait for 2 months to get an appointment to see the doctor. 2 months I was waiting just for a headache. And I could, even my medicines are not available on the over the counter. But the same is available at least in the US. So it's all restricted there in the developed countries. So the same thing is getting implied on the underdeveloped countries. That's what
I don't know. We have a more robust system in the sense that as long as they don't, where the problem comes is this cartel formation. Okay, Vajpayee. That insurance, not insurance, whatever you can call it. Okay, those guys will put pressure on the hospitals to reduce the cost. Okay, and then they say you have to pay for the transport of the patient. All those fancy things. The moment, and this is true about all industries, the moment the government sets it with the regulator, the industry goes down. Both the IT and the medical, till recently you don't need a license to start a hospital.
Not at all. I can start.
Well, where's the license? When do you have a license? You don't need a license. Because most of the hospitals were started by doctors who would start a nursing home. Till recently there was no license. I don't know now there's a license.
Yeah, you have license and your other things also.
No. What license you have is the state government saying that you have this thing. But you don't get a license from the central this thing saying that you can start a. So nobody knows what type of a hospital you are running.
Only we fall under that Karnataka State's
Huh.
All Hospital Medical System Establishment Act, which was implemented.
That's what. It's a shops and medical establishment act. That's okay. That is all shops. So even a kirana shop will have that.
It's not mandatory.
No. What I'm saying is, like, we have NABH. Okay. NABH should actually give the license to start, so that there's some standard involved in that. All hospitals should have a standard. Like ISI. Oh, ISI, no?
ISO.
Huh?
ISI, Indian Standard.
ISO
or ISI.
That we don't have. So it's a vague thing. That's because the government wasn't involved in it. No. The moment the government starts, they will start putting all sorts of restrictions. So it will work. But healthcare itself is not, there are other things.
So a bit of, they want to be all startup, they want to be venture capital. What is your ideas?
See, you
Just
can
an
have,
overview of
you can have
all entrepreneurs.
Money.
Main question is
money
money. Yeah.
can be got to three sources. Okay, one is a bank. The bank will give you money, and it will give you money on a straightforward interest. In return, you have to put some sort of a collateral. Okay. Now, the other thing is you go into a venture capitalist or you go to an angel investor. A venture capitalist is a guy who would put in money. Okay, the venture capitalist works like this. He will invest in 10 companies and he expects 3 of this to give returns above 400%. Okay, 3 of this to fail and the rest to break even. He works on a principle of pure statistics. So, Because of this, he would rather, most big venture capitalists would rather invest in the least number of companies. So that statistics favor them. Now, one way to do that is, they will invest, for example, KFH, which I know, they will not invest less than 5 million US. They won't go, if you ask them less than this, they won't. That's a sort of a cutoff. We have cutoffs for medical college, AMO, cutoff. 5 million. Anything less, we're not interested. And the reason they are doing this is this. They are working on a basic principle that 3 will do very well, they'll make the money and more. 3 will fail completely, all the money will be wiped out. And the Baki 6 or 4, Baki 4 will not, may do well, may do, but they will get the money. Venture capitalists also will require an exit plan. Okay? They are very clear that they are in your business for so many years. Normally, it is between 3 to 7. Some lucky guys like Shantanu has 10. I don't know how he managed. Okay, but normally it's 3 to 7. And more often this way, not that. 7 is, they want to get out. Now, how do they get out? They would rather have an IPO. You know what an IPO, you all had one talk today in the morning. Okay? Or IPO or else what? How else can they get out?
Some other investor.
Exactly. Switch their capital to somebody else who takes care and runs it. Okay. So they will swap their shares. But they will get out. Come what may, they will get out. Okay. What are the other one? Angel investors. Angel investors are guys who are characters. They have a lot of money. Okay. They will not fund huge amounts. They will fund small. They are like gamblers. They are buying stock in small amounts. So, if I was an angel investor, I would invest, say, 1 lakh in here, 5 lakhs in here, 2 lakhs, like that. Okay. My corpus may be 50 lakhs. But I won't put the full 50 lakhs in one person. I'll give it in smaller amounts. And I don't take any, I believe in you, so I'll put it. Okay. Normally, an angel investor will supplement a VC. Why?
Depending on their returns, they will have that.
Because VC would have done a
Think.
Okay, VC would have
The
done a
VC would have done the due diligence. Okay. Why should I put in money just like that? Because I like your face? No. I want to know whether your plan works. Somebody has to go through it. The VC has already gone through it. So I trust the VC. But let me tell you, VCs can be fooled. 90% of the VCs send people who don't understand it. They are finance guys. They don't understand. You tell them that this wheel has 5 spokes, so it works. And so you take it for granted. Okay. A guy in engineer would have said, 5 spokes, how will it work? It needs 2 more. Yeah, but right now I don't have money. Okay. So, VCs also can get fooled. Don't think that VCs are, because they outsource their due diligence to somebody else. And it depends upon that quality of that person. See, VCs also, like IT companies, have a lot, massive turnover. Okay, the guy who is coming for due diligence today will be Tomorrow he'll come again, "Hey, you came yesterday, no? No, I'm coming from another company." Okay. So,
Okay, so this 3%, this 3 getting failed is that pooling of VC.
yeah.
This failing of this 3%.
No. Even a good business plan can fail for various other reasons. Okay, it's not necessary that every. Do you know the statistics? You'll be shocked. You'll all stop trying to become.
Mean, medium,
Huh?
average, mean, medium, average. Take out of 10.
Read this. This is the fact.
But still you have a lot of VCs coming and putting money in. Okay.
But I think we have read some survey on this, why these are failing because of different dimensions. They are giving the thoughts like.
First big thing.
Fail to plan. Yeah.
This is the biggest thing. They don't have contingency plans, they don't have. And I don't know, they seem to know that it will work.
And that leads to the final concluding thought for you. They have to approach someone. There's written on the wall. Nobody is having enough to
Okay,
do it.
if you need
Now,
to
how
go,
do you pitch? What should be the pitch?
even if you go to a
Business-
banker,
Yeah,
okay, you need to have a business plan.
that's the final.
Okay? First create a business plan. You know why a business plan is important? Tell me.
No, it will have all your details, even the new details of how the business will be running.
Knowing that I'm fat, knowing that I have glass of heart difference is
It will also have the contingency plan, for example, or it will have the risk, it will have everything.
correct.
Just like in
How does it
our-
help?
So what I'm
Again,
going to,
come.
I have to tell what I'm going to do.
Okay,
with
fine,
that
fine.
money.
That I agreed. That I've already told you. You have to send it to the bank.
Whether I'm going
You are
to buy
getting
a
money.
car-
Fine, that's okay. Other than that,
The returning back plan. I mean, how I'm going to. I mean, I'm buying a car on loan. How do I repay the loan? Something similar to that. Business, the bank may be investing or VC may be investing. I'm borrowing, and how I am going to improve my business and return it.
sure,
That is a plan.
that's true. That comes in going to the bank. Okay.